The incidence of TBI in other than war, than actual combat is something that really has become a part of the data sets and so on. Turns out 80% of the TBIs in the military are not in the combat zone. They occur during normal life, driving, doing whatever accidents, and in training. Both from standard hand-to-hand combat training, from other kinds of, and from the firing of these high velocity weapons and so on, shoulder fire weapons and so on. We're finding that repetitive blast injury from the training environment is a significant issue. Congress has directed the military to actually address that, come up with sort of like a radiation badge, whatever, that'll let them, their medical record, know how much their exposure is to that, so they can be more aware of that. That is an initiative currently in progress to really understand the impact of all of that. And then for the training forces to try to reduce that exposure, put safety measures in place. Just like we wear shields when we're exposed to like X-ray radiation as physicians, there are things that you can do to try to reduce the amount of repetitive exposure, both for the soldiers who are training, and especially, this is the one that's actually become really hit us, is the people that are doing the training are the ones that are there for months and years on end. They're training the soldiers and sailors, Marines, and so on, for who come there maybe for a few days, but the training cadre are there for months or years, and they have significant issues. I've interviewed many of them who, at the end of a day, really are in a brain fog after these repeated blasts that they're exposed to.